Thank you so much, Mitra ma'am and Sita ma'am, for giving me this opportunity to talk on breaking sad news in case of the stillbirth, because we all know that this is the biggest obstetric nightmare, and whenever we are facing such situations, ये हाल तो होना ही होता है. But to bug you all up, and including myself, I would like to say that गिरते हैं शहसवार ही मैदानी जंग में, वो तिफल क्या गिरे जो घुटनों के बल चले. So we all do such hard work. हर बार बहुत अच्छी चीजें होती हैं, but sometimes these mishaps do occur. So let's prepare ourselves with an aim to understand the importance of empathy in such situation and to learn effective communication techniques. We all acknowledge that we face different type of stress, but the stress posed by a pregnancy loss overpowers them all. Family, when we talk of mothers, they suffer from complicated and prolonged grief, which can last for even more than 1 year. And this duration and complexity was directly dependent on the way she was informed about the stillbirth. And this was published in Lancet 2019 and a huge study. The husband is also feeling pressurized at these moments, stressful, very anxious, and there is loss of income and finances. Let's talk of this population, that is obstetricians, because communicating fetal death news was one of the most difficult duties as perceived by residents. When we talk of senior clinicians, they feel that their reputation is at stake, their competence can be questioned, there is fear of litigation, self-doubts do creep in, there is drainage of self-confidence, and it takes average 3 months to regain confidence. And we don't know what further emotional liability an obstetrician is facing after facing a stillbirth in her clinic. So we already are aware of the spikes protocol, which were formulated in 1995 for oncology for breaking news about cancer. And such a protocol was extended to other departments, including obstetrics and gynecology, but there is a sparse literature to support its validity and complete utility in different scenarios like ours. So here are some rules which I would like to share with you. I hope they help. So instead of spikes, we suggest soaps. Soaps, stands for sensitize to the situation in a sitting position at a symmetrical level. O stands for observe emotions of the sufferer and the family, organize your response and order notes. A stands for acknowledge reactions, accompanying person and answer queries. I'll elaborate them. Then P stands for prognosticate the case, provide for the testing, prepare for respectful stillbirth care. And S stands for surrogate clinician should never go to break the sad news in your case. So first S, that is sensitize, symmetry, and sitting position. Sensitization means while you're talking and you have built up the environment in privacy in a room, talk to the immediate family and the person who initially accompanied the sufferer, however distant relative he or she might be, because they would vouch for the facts or the information that you provided at the initial encounter. You should be sitting on the same height of the chairs. Neither you should be standing nor the patient's party should be standing. That breaches entire trust building process. Then symmetry, it means that eye contacts are always maintained and the eyes of the sufferers, of the family and the clinician should be at the same level. It means a lot. Empathetic means you have to tell them that I understand what you feel, and you do not have to say that I feel very bad for you. So there is a huge difference in being empathetic and being sympathetic. Although sympathy is a good emotion, but it should not be exercised in such a situation. Then appropriate usage of hand gestures. It is again very important that while disclosing this news, you have to keep your arms and elbows at the level of table with locked palms like this. So you should not be, or we should not be sitting like this. We should not be sitting like this. We should not be keeping our hands below the table. That directly indicates you're trying to hide something. Then while you're talking, open your hands facing palm upwards, like I understand what you're going through, or do you want to ask further questions? Rather than using index finger or a pointing gesture to explain, like this happened this way and you brought them here, then this happened. So this is a very bad way of communicating sad news in such situation. then it is recommended that you touch your heart area at least randomly, at least once during the entire conversation. Say, if you say, see, these things happen, sometimes there are reasons and sometimes, there are no reasons. So trust me, this is one of the most important aspect of conversation in these situations. If you feel comfortable, if you feel that patient will feel comfortable, you can hold the hand of the patient. Otherwise, this particular point can be omitted, and it basically depends on the type of population you're dealing with. Second point is mobile phone usage is strictly prohibited. You have to show them during the start of conversation that you have put your phone in silent mode, and you don't have to show them to see I'm putting it. You just have to do it like this and keep it over here. But always keep your mobile with you and keep an emergency dial or SOS number at your finger point. Observe emotion and organize response. What does that mean? पहले आप देखिए कि सामने वाले का response क्या है. Suppose it comes as anger. So you have to deal with them with firmness, not being calm, not being louder than them, or not being yourself angry. It will escalate the situation. If they are feeling sad, then physical gestures like tapping shoulder will help in this situation. If they panic, then offer, say water or tissue papers and divert their mind. If they show guilt, then you don't have to accept their guilt. Like if they say कि मेरी गलती थी कि मैं उसको टाइम पे नहीं लेकर आ पाया, you don't have to say कि हाँ ये सही है. You have to say कि नहीं, despite of the fact that you were a bit late, but you did your best, and 2 से 3% cases में इस तरह से हो जाता है. So that calms them too much. Never share your personal stories like मेरे साथ भी ऐसा हुआ था, मेरी चाची की बेटी के साथ भी ऐसी हुआ था. They are not at all interested in you, your चाची की बेटी, or for that matter, any of your previous patient. So stick to their points and their stories. Next comes words. Using words like we saw in video, खेल खत्म, खल्लास, निमट लिया. चाहे कितना भी आपकी वो लोकल लैंग्वेज में फेमस हो, you don't have to use it at this time. Second, when we see in Bollywood, one physician coming out of OT और बोलते हैं कि sorry हम आपके बच्चे को बचा नहीं पाए. Oh my God, this shows direct incompetence. हो या ना हो, लगता यही है कि बचा सकते थे बट बचा नहीं पाए. सेकेंड वर्ड, आपका बच्चा नहीं बचा, ये तो डायरेक्ट केयरलेसनेस हुआ. बेटा तुम्हारे लिए खाना नहीं बचा. Carelessness, you did not care कि मैं भी खाऊंगी. So same way this is depicted. Then this particular phrase, we lost the baby, sounds very insensitive. However, frequently it is used in Hollywood movies. We don't have to use it. So what are the substitutes? I'll try to give one example, like your baby is no more. We found that the heart sound was not present at the time of admission. We confirmed it by ultrasound, and it is equally saddening for all of us as a team to know that your baby did not survive in utero environment, or whatever language you want to use. So this can be used in case of intrauterine fetal death, and while you're dealing with the perinatal still death, like during birthing process or maybe during cesarean, the type of phrasing that we should do is that during birthing process, baby couldn't survive, say the pain, hypoxia, stress. Even in the most normal of the labors, there is a particular percentage of the babies which are unable to withstand such lack of oxygen during birthing process. So these kind of situations can be built up, and these types of words and phrases should be used. Then acknowledge reactions. If they get angry, you should acknowledge कि okay angry, but give them some time, because sometimes giving them 2 or 3 minutes also cools them down. But do not lose the eye contact during this entire scenario. Always have some strong looking person with you. I don't say that we have to be with a commando, black hat commando or something, but one strong looking person standing by your side. Answer all their queries and invite them and tell them कि अब आप मुझसे जो कुछ भी पूछ सकते हैं, आपकी जो भी डाउट्स हैं, आपकी जो भी आगे के लिए क्वेश्चंस हैं, आप बताइए मुझे. और इस तरह के वर्ड्स कि मैं रेडी हूं जवाब देने के लिए, ये भी नहीं यूज करना है. यू जस्ट टेल कि आप मुझसे पूछ सकते हैं. Use data and percentages to explain. Believe me, this is one of the most important strategy. If you say कि देखिए 2 से 3% केसेस में ऐसा हो जाता है, 100 में से एक मरीज के साथ इस तरह से होता है, 1000 में से एक बच्चे को इस तरह से हो सकता है. This gives them the clarity about the situation. Then prognosticate and provide further testing. Now, if you keep on talking about the baby, they will be talking about the baby, thinking about the baby. You bring them to the mother's condition. Tell them whether she's in fine, whether she's still critical, whether she needs more treatment, admission, or whatever. Then offer them autopsy and placental testing, and you say that this is a protocol and this will help both you and you as family to decide further course of action in future pregnancies also. Maintain transparency. Even if you have to say कि मुझे नहीं मालूम ये कैसे हुआ, be honest. Because if you are saying कि हाँ हाँ हाँ, अरे एक बार बीच में 130 190 ब्लड प्रेशर हो गया था, ये भी एक कॉज हो सकता है भाई. So, and if they go out and verify this fact, there's a blood pressure of 130/90 affect baby, answer will obviously come no. So that puts now your reputation at stake. So be very honest and transparent, because सच्चाई बहुत लंबी चलती है. Then, as I said earlier, last as for soaps is surrogate. Never ever send your surrogate. One misinformation, one mismatch, one different and difficult word used, and the game is finished. So use your words very cautiously. Deal with your case. जितना आपने आज तक प्यार लिया है, ये situation भी हमें खुद को लेनी है. We feel very proud of ourselves. So we should be very, skeptical about sending, however competent the person may be, to break such sad news to our patients. So with this determination in mind, that although I'm sure all of us are doing these things only, but let us all do this in systematic and organized way. That will help us build the trust of patients and ease out our communications and stress as well. Thank you so much.